Hello, welcome back to another anatomy walkthrough. I am Mr. Shrum, and we are going to look at muscles of the upper body today. Skeletal muscle is usually connected to two bones and spans a joint. And when a muscle contracts, when you flex a muscle, it shortens and it generally moves one of the bones it's attached to, and then the other bone it's attached to will stay still. So one will be moving and the other will be staying still. It's important to know the bones a muscle is connected to so that we can understand what movement that muscle will perform. The more stable or fixed attachment of the muscle is known as the origin. The origin of a muscle is generally the proximal attachment, meaning it is closer to the head of the muscle. So check out this picture here. The origin for the arm is up here. The movable attachment of the muscle is known as the insertion. The insertion of a muscle is usually the distal attachment, meaning it is further from the head. So here's the insertion. Yeah. Origin up here, insertion further away from the body. Knowing why a muscle has a specific name can help you remember what muscle it is. So let's look further into that. Now, naming muscles, you generally consider these things: shape, location, attachment site, size of the muscle, orientation of the fibers, relative position, and function. And as you learn the muscles, try to figure out why it was given that name, and then find that muscle on your body, noting where it begins, the origin, and where it ends, the insertion. This diagram shows stronger, weaker muscles and their names. The pectoral girdle includes the clavicle and scapula, which connects the upper limbs to the axial skeleton. Strong, broad muscles are necessary to keep the sternoclavicular joint stable. These muscles include, on the anterior side, the serratus anterior and the pectoralis minor. On the posterior side, the back side, trapezius, or the traps, rhomboideus major, rhomboideus minor. Now your serratus anterior pulls the scapula forward, also known as abducts, and upward rotation of the scapula. The origin, lateral surface of the upper rib. So up here, insertion, medial border of the scapula. Origin near the ribs, insertion, scapula. The pectoralis minor pulls the scapula forward, abducts, and downward rotation of the scapula. Origin, the sternal ends of the upper rib, and then the insertion is the coracoids process of the scapula. The traps, they're on your back, closer towards your head, on your upper back, elevates and adducts the scapula. Upward rotation of the scapula and draws the head back. Origin, occipital bone, spines of cervical and thoracic vertebrae. And the insertion point is the clavicle, spine of the scapula, and the acromion process of scapula. Rhomboideus major elevates, adducts, and downward rotation of the scapula. Origin, spines of several thoracic vertebrae. Insertion, the medial border of the scapula. And then you have the rhomboideus minor. It elevates, adducts, and performs downward rotation of the scapula. Origin at the 7th cervical and 1st thoracic vertebrae. So if you remember how we named the vertebrae, how they're divided into certain regions, that's where it originates. And then the insertion point, medial border of scapula. So these muscles of the pectoral girdle perform the following movements: abduction, also known as protraction of the scapula; adduction, also known as retraction of the scapula; elevation, upward rotation of the scapula; and downward rotation of the scapula. So if the scapula is moving, you're using your muscles in the pectoral girdle. Abduction or protraction of the scapula is performed by the pectoralis minor and the serratus anterior. So these two muscles will protract the scapula. Adduction or retraction of the scapula is performed by rhomboideus major and minor and the traps, or the trapezius. Elevation of the scapula is performed by the rhomboideus major and minor and the traps as well. Upward rotation of the scapula occurs when you abduct the humerus, and it's performed by the serratus anterior and the traps. Downward rotation of the scapula occurs when you adduct the humerus, and it is performed by the pectoralis minor, the rhomboideus major, the rhomboideus minor. And that is all for the muscles in the upper body for today. And we'll get into a bit more next time. But I hope that cleared some things up for you, and those diagrams will help you understand what parts of the body and the upper body are moving and where you want the scapula to go. How you move the scapula will determine what muscles you're using. But okay, that's it for now. I will see you guys later. Bye-bye.